to turn it over to our district supervising nurse, Laura Dyson.
Right. Hi, everybody. Thank you for coming tonight. I am Laura Dyson. I am the nursing supervisor for Palm Springs Unified. So tonight we were going to talk about some COVID-19 best practices, and then we'll go into a little bit of vaccine frequently asked questions to try and see if we can get some of your questions covered, and then we'll do a little question and answer at the end. Okay. So let's go into this. All right, so how is COVID-19 spread? So we know that COVID-19 is spread between people who come into close contact with one another. So close contact usually means within or less than 6 feet of each other. So it doesn't mean somebody that you passed by in the grocery store or somebody that maybe you just walked by, but close contact means within 6 feet, and that's usually for an extended period of time. Usually that marker is 15 minutes. And so that's how we define what close contact means. It's spread by respiratory droplets from when a person coughs or talks or sneezes. And what happens is those droplets can land in the mouths or noses of people who are nearby, or could possibly, you can possibly inhale them into the lungs. And so that's how COVID is generally contracted. We can also contract COVID by touching contaminated surfaces. So once you touch a dirty surface and then touch your face or your nose, COVID can be transmitted that way as well. We also know that COVID can be transmitted by asymptomatic carriers. So asymptomatic means people who have the COVID-19 but are not showing any symptoms. And so asymptomatic means that they have no symptoms being presented. All right, so how do I protect myself from COVID-19? So one of the best ways to make sure that you're protecting yourself from COVID-19 is by making sure you're wearing a mask whenever you're in a public space, and making sure that you're wearing that mask in the correct manner. So you want to make sure that you wear your mask fully covering your nose and your mouth. It's really important that we remind our children and our students while they're wearing their mask not to touch their face. I know a lot of times, and if you've ever, when you watch the news, you see people do this all the time, but they're pulling their mask up and down on their face, adjusting it on their face. But we have to remember that for the most part, our hands have been touching all those dirty surfaces. And so once we touch those dirty surfaces and then we touch our mask, which is on our face, we're putting ourselves at higher risk to contract COVID. So we want to be really, really careful about touching our faces and touching our masks while they're on our face. And again, we want to stay at least 6 feet away from others, because we know being in close contact, which is less than 6 feet, is a way for COVID to be contracted. So making sure you're staying at least 6 feet away from anyone who is not part of your immediate household. So nobody that doesn't live with you. So we know that COVID spread primarily from person to person. So we want to avoid crowds or crowded spaces by staying home as much as possible and limiting that contact that we have with others. We can do this by buying groceries and medications online if that's possible for you. Try and do your banking online as well. And even your doctor's visits. Most of the time now, doctor's offices have gotten really good at doing telehealth, so online or over the phone visits. And that will prevent you from having to actually go into the doctor's office, but still allow you to get that care. But the biggest piece to preventing COVID-19, is, in addition to wearing that mask, is making sure that you wash your hands often. We want to make sure we're washing our hands often with soap and water, if that's available, for 20 seconds. Or we want to use that alcohol-based hand sanitizer that contains at least 60% alcohol. So beware of the hand sanitizer that you're using, and making sure that it contains at least 60% alcohol. All right, so let's go over what is the best way to wear a mask, because we see people wearing these masks all the time, different ways. This diagram here on the page will show you all those do's and don'ts of wearing a mask, but you want to make sure that you wear your mask pulled up all the way across that bridge of your nose and all the way underneath the bottom of your chin. It's really, really important that you choose a mask that fits snugly around your face and that doesn't have any gaps around the edges of the mask. The reason for that is it lets out those respiratory particles. So if you are to cough or sneeze into your mask, or even breathing, just regular breathing, it allows those particles to escape outside of the mask, and so then it can cause spread of the disease. So this picture with the do's and don'ts shows some of those most common mistakes we're seeing in our community. You can see here, you want to make sure that your mask doesn't slip down over the tip of your nose or fall below your nose. We see that all the time, right? It's also important that you don't leave your chin exposed, or that you don't pull your mask down even below to your neck, because a lot of times we see people do that as a way to talk to other people. We know it's difficult to talk to people in a mask. Sometimes it's really hard to understand people when you're talking to them in a mask, and so our tendency sometimes is to just pull that. When people are saying, well, what did you say? What? It's our tendency to like pull that mask down and just say what we need to say, but really that's not the purpose of the mask, and it really it's counterintuitive to the wearing of the mask. So we want to make sure that mask stays tight and snug around our face all day. Also making sure that your mask, again, doesn't have any large gaps on the side, because that allows those respiratory droplets to escape, and making sure that it continues to have that nice tight, snug fit around your face. I do want to mention here that students in all grade levels, when we return to school, are going to be required by the California Department of Public Health to wear a face covering all the time while they're in school, unless they're exempt. And there are some exceptions to the rule that would allow a student not to have to wear a mask at school, but generally those are students with medical or mental health disabilities, and we'll go over that a little bit later. But for your students who are just kind of uncomfortable wearing a mask, right? And I'll say that when I first really started having to wear the mask, it wasn't comfortable for me either. It's hard to breathe in. You just kind of feel a little bit claustrophobic. But getting comfortable in wearing the mask takes time. And so having your student wear the mask around the house, or just start wearing the mask for short periods of time can help them kind of get over that uncomfortable phase of wearing a mask. If your student does have a medical or mental health condition that would prevent them wearing a mask, you might want to consider getting them a face shield with a drape that goes along the whole bottom edge of the face shield, if they're able to wear that. But that's a way to still protect them and protect the people in their classroom without when they're unable to wear that mask. All right, so masks are really simple. They're an effective way to slow the spread of COVID-19, but it's crucial that we wear this mask. It protects us it protects us and others from getting the virus. It can also protect you from spreading the virus to others, which is really important if you're somebody who is an asymptomatic carrier. So remember, asymptomatic is the people that have the virus but are not showing any symptoms. So this diagram here on this slide shows a visual about what happens for somebody who sneezes, and how the virus can really spread through the air. In this photo, the male on the left is considered to be infected with COVID-19. You can see in that top picture there that there's a high rate of transmission when neither of the parties are wearing a mask. But the risk decreases in the second picture here once the woman has her mask on. Once that infected male here in the third picture puts on his mask, the risk is significantly downgraded. So we went from a very high risk up here to a medium risk there, just by one infected person wearing a mask. Once both parties have put their masks on, the risk drops to low. So it's just one way, and there is other factors. There's the social distancing piece and the time of exposure, the time that you're around somebody. That makes a difference in this scenario about becoming exposed and becoming infected with COVID-19, but this really gives you a good visual of how important it is to wear a mask. All right, so at this point, I want to start to go over a couple of the COVID-19 frequently asked questions. People stop me in the community all the time and ask me many of these questions, so I want to try and address them and see if there's some of the same questions you guys have. So, can I get COVID-19 from the vaccine? The answer to this is no. You cannot get COVID-19 from getting the vaccine. The vaccine does not contain any coronavirus. It doesn't contain any, there are no pieces of COVID-19 inside of the vaccine, so you can't transmit COVID-19 from getting the vaccine. The vaccine is just simply made from a gene that's inside of the virus, and it's placed into the vaccine to kind of make that immune system start to work really well. And we'll go over that piece a little bit more in just a few more slides. But the short answer to this question is really no, you cannot get COVID-19 from the vaccine. So do I need to get the vaccine if I've already had COVID-19? We know a lot of people, everybody knows somebody that's had COVID-19, right? And so the question is, well, I've already got it. Why do I need to get the vaccine? And so what we know now is that there is some protection that we gain from getting the infection naturally. And what this is called is natural immunity. But what we don't know is how much protection that natural immunity is really going to provide for you if you were to come in contact with the virus again. So what we might see with this is somebody who acquired the virus maybe say back in April or May of last year, and now could actually be reinfected by coming into contact with the virus again. So we don't understand yet really how long your natural immunity from having COVID is going to last. And so what our research shows us is that reinfection is really uncommon during those first 90 days though, right after infection. So in those first 3 months, right after you've been infected, what we've shown is that getting reinfected or recontracting COVID is really, really low. Your rates of that are really low. But getting that vaccine, it will give your immune system the needed boost that you need to protect yourself against the severe health risks that are associated with COVID-19 if you were to get reinfected. And so what we're seeing is that people that become reinfected a second time are having a more severe reaction to COVID-19. And so by getting that vaccine, we're preventing them from having those severe reactions, which could be really the difference between somebody being hospitalized or somebody recovering at home. All right, so how long does it take the vaccine to work? So what we know is that it typically takes about 2 weeks after you've completed the second or the final dose in your vaccine series to become fully infected. It'll take your body's immune system time to react to that virus and to the vaccine. And it takes a little bit for the body to develop the immunity that you need to protect you. So the timeline is generally about 2 weeks. The vaccine's efficacy, or the way the vaccine, how efficient the vaccine is inside of you, will determine how much protection is provided for the vaccine. So right now there's Pfizer and there's Moderna. Those are the two big vaccine makers it's the two vaccines that are being distributed in the United States now. Both of these vaccines were found to be about 95% effective in the early months after the vaccine. So what that means is that if there was 100 people who would have contracted COVID, the vaccine would prevent 95 of them from getting it, but not all 100. So we still have that little tiny window of about 5% of people that receive it. But the good news is that even those people who did not get the disease after receiving the vaccine did receive, I said that wrong. The people that do contract COVID after having the vaccine do seem to have a very decreased reaction to COVID-19. So if they had a really, really severe reaction the first time, that if they recontracted it again, they would have a much lesser reaction to that. So again, this might mean the difference between hospitalization or home treatment for somebody. All right, so do I still need to wear a mask and avoid close contact with others if I have gotten 2 doses of the vaccine? So yes, the answer to this is yes. We know that vaccines are one of the most effective ways to prevent disease, but we still need more information about how COVID-19 and how the vaccine protects people in real life conditions. So we're researching how the vaccine will prevent a person from spreading the virus to other people. And even if this means you don't get sick yourself, we still need more information about whether you could transmit the disease to your loved ones. So how do we work around this? We wear a mask, we continue to social distance with people that are outside of our home, and this is how we continue to protect infecting people around us who haven't received their vaccine doses. We know that there's lots of people waiting to get the vaccines still. And so if we were one of the lucky ones that allowed us to get the vaccine now, we want to continue doing all those prevention strategies like wearing our mask and social distancing and washing our hands to make sure that we're protecting all those people in the community who are still waiting to get the vaccine. Also remember, it takes about 2 weeks for your immunity to build up enough to protect yourself after receiving that vaccine. So continuing to do all those mitigating strategies, wearing your mask, washing your hands, those are really still very important after you get the COVID-19 vaccine. All right, so what similarities and differences are between what similarities and differences are there between vaccines being offered now? So there's currently 2 types of vaccines being distributed across the United States right now. There's the Pfizer vaccine and there's the Moderna vaccine. Both of these are made up of the same type of, it's messenger RNA, so mRNA, if you've ever heard that term. It's a type of vaccine. It just delivers a little bit of a genetic code to the cells, and it causes your immune system to activate, and then your immune system develops antibodies, antibodies are what help protect you against the disease. So they're pretty similar. There are a few differences. The Pfizer vaccine is approved for people who are 16 years and older, and it consists of 2 doses, and they're given 21 days apart. And this one's 95% effective. The Moderna vaccine is approved for those who are 18 years and older, and it consists of 2 doses given 28 days apart. So it's 21 days or 28 days. And this one is 94% effective. So remember, they're both really close, 94, 95% effective. So they're pretty similar. There is a new one that's coming out on the market. It's not quite ready yet, but Johnson & Johnson has recently developed their vaccine as well. They did apply for an emergency use authorization on February 4th with the Food and Drug Administration. And that vaccine's predicted that it could be administered to the public beginning in March, so coming up pretty soon. This one's going to be a 1-dose vaccine. So where Pfizer and Moderna are 2-dose vaccines, this one's a 1-dose vaccine. And it's predicted to be up to 85% effective against severe disease, and it's going to be 72% effective against mild disease. So remember, severe disease is those disease that causes maybe hospitalization or an extended, a more severe illness versus your mild diseases maybe are the people who just get, a stuffy nose, a headache, they kind of don't feel good for a couple days, kind of more similar to a flu or a cold, but doesn't require them to either go to the doctor or even be hospitalized. All right, so will I test positive after receiving the COVID-19 vaccine? So no, the answer to this is no. A vaccine won't cause you to test positive on a viral COVID-19 test. So what happens is that your body is going to develop this immune response, which is our goal of vaccination. In that case, you might develop antibodies. So there's 2 different things. There's antigens and there's antibodies. Antibodies are the good things. That's what we want your immune system to develop, because that's what helps you fight off the disease if you come into contact with it. An antigen tells us that you actually have you actively have COVID-19. And so that's what we're testing for. When you go to all the different testing sites right now across the state, that's what we're looking for, is the antigen on the COVID-19 test. But the vaccine doesn't contain any live coronavirus. So it won't give you the antigen, it's going to give you the antibodies, and that's your immune response. So 2 different tests. There's an antigen and there's an antibody test. The antigen tells us that you have actually have COVID-19 right now and are infected, the antibody test tells us that you've either had COVID-19 and your body's reacted to that, creating immunity, or that you've had the vaccine and your body's created that immune response and now you have immunity as well. All right, so how long should I wait after I get how long should I wait to get the vaccine after I have had COVID-19? So generally the rule is that if you test positive, you should wait at least 10 days since your symptoms started. And you wanna make sure that you've met all the criteria to discontinue your isolation. So what that means usually is waiting 10 days after the date that you tested and making sure all your symptoms have improved or are getting better. After that, remember that it's thought that you have the antibodies for up to 90 days after you've been infected. So you don't have to run out and get the vaccine right after you've been infected with COVID, because the science is showing us that your antibodies and your protection, your immunity will last for up to 90 days after you're actively infected with COVID. However, if you want to go get that vaccine, you can do so after your 10-day period is up. So you don't have to wait, but you can. All right, so can my child receive the COVID-19 vaccine? So right now, all the vaccines that are on the market, so remember we talked about Pfizer, we talked about Moderna, we talked about that new Johnson & Johnson vaccine. These are all only authorized for use of adults or teens. So remember 16 or 18 was the marker for Pfizer and Moderna. So the Academy in Pediatrics is urging teens, so 16 to 18-year-olds, to get the vaccine as soon as it's available to them. Right now we're working on vaccinating our older population, so we could see, in coming months, eventually it will be available to our younger population. But before these vaccines can become available to our younger teens and children, we still have to do more clinical trials, more research to make sure that they're safe and effective for these age groups. The reason for this is that children don't always respond to medications or vaccines the same way that adults do. So we can't just start giving it to children and assume that they'll respond the same way. We have to do a lot of research and monitoring to make sure that this vaccine is going to be safe to give our kids. So we're still doing those studies. We're still making sure that it's going to be safe for our kids. And once we determine that, then we can take the next steps in figuring out when children can be vaccinated as well. So will a COVID-19 be required for my child to attend school? So the answer to this is complicated, but once a vaccine is shown to be safe and effective in children, so once we do that research and we figure out that this is a safe vaccine for kids to get, then people like our health authorities will issue guidance. And so those are people like the CDC, the American Academy of Pediatrics, and what they do is they issue a recommendation on how children should receive the vaccine. Once the health authorities do that, the state government, though, is the one that will decide. So the state of California is going to be the one that decides whether that vaccine is going to be required to attend school. And so it's not known yet. We don't know yet. We don't know if the state legislature is going to require those COVID vaccines for school attendance. Like we talked about before, lots of clinical trials are underway right now for children, but at this time, there is no vaccine that's approved. So no, right now the answer is no, your child will not be required to attend school. But I do want to take a moment to remind you that the vaccine laws for attendance in California haven't changed. We have some of the strictest vaccine laws in the country in California for children to attend school. And as a school, we are required to follow those laws that have been put forth by the state of California. During this pandemic, we've really seen a declining rate of students who need their vaccines but have not received them yet. And so what this really means and what the worry is that we could see an outbreak of other diseases. So things like measles and whooping cough in conjunction with this COVID-19 pandemic. And so I really want to encourage parents to contact your child's pediatrician and make those necessary appointments to ensure that your child has received all those recommended and required vaccines in order to attend school. Most doctor's offices now are accepting well child visits. They're even doing some drive-up vaccine administration, so you don't even have to go into the office. You can do one of those telehealth visits or telephone visits and get that part out of the way over the phone, and then just do a drive-up and get the vaccines administered in your car. So you don't even have to go inside the office. And then once your child gets those necessary vaccinations, please submit those records to your child's school of attendance so that we have all those up-to-date records on file, because we do need those. All right, and so I'm going to close this out with just a reminder that we've done a lot of talking about vaccines and mask wearing and washing our hands and how much that is important, but COVID-19 testing is still important. So we've had lots of people in the community in Riverside County in particular, and the Coachella Valley, have been deeply impacted by COVID-19. Our rates have been really, really high, but as these vaccination rollouts are still taking place, even if you have recently been vaccinated, you should continue to seek testing if you're experiencing symptoms of COVID-19 or you think you've been exposed to someone who's positive. We know that there's recently been several COVID-19 variant strains that have emerged. So that B117, which is the UK variant, and the South African variant. And so testing really, really helps our community health partners know which community spread, how much community spread is happening, where it's happening, and what strains are being seen locally in our areas so that we can start to determine next steps and best practices. So it is still so important to continue to seek out testing if you become symptomatic. And I think that closes me out. So let's see. Yeah. All right, so I'd like to just open it up for questions if anyone has any.
Hola, buenas tardes. Tengo dos preguntas. La primera, cuando inició el Zoom, ella estaba hablando de unos medicamentos que debemos de tener en casa. ¿Cuáles serían? Esa es una pregunta. La segunda, ¿cuánto tiempo dura las inyecciones que ponen para lo del COVID en el cuerpo?
Nadia, can you do that translation to English?
Sure.
Thank you.
Señora, ¿me lo puede por favor repetir un momento? I'm going to ask her to repeat that for me.
Okay.
Señora, ¿me lo pudiera repetir, por favor? ¿Tus
Sí.
preguntas?
La primera pregunta es que ella hablaba de que tenemos que tener medicamentos en la casa, ¿no? ¿Cuáles serían los que
We were speaking about that we needed to have some medication at home at the beginning of your presentation. What are those medications? That's the first question. La segunda pregunta, señora.
La segunda pregunta es ¿cuánto tiempo dura el medicamento de la inyección que están poniendo para lo del COVID?
How long, and the second question is, how long does it last, the vaccination in your body after you receive it?
So the first question I think I'm going to need a little more clarification on. I don't know that we were talking about medications. So if she could clarify just a little bit further.
Señora, la primera pregunta, usted dijo que al principio de la presentación se dijo que había medicaciones. ¿Ella quiere que le dé un poquito más de información acerca de eso? ¿No está segura de a qué se refiere?
Cuando dijo ella de que tenemos que cuidarnos, ¿no? Usar tapabocas, lavarnos las manos, evitar la multitud de gente. Ella dijo que tendríamos que tener quizás como anticuerpos, como por ejemplo si tenemos bajo las defensas, ¿verdad? Entonces yo quería saber, porque ella mencionó dijo medicamentos, pero no sé si se refería a la inyección.
Laura, you talked about having something for low defenses. You talked about avoiding crowds, and you talked about washing your hands, and you also talked about some antibodies. She wants more details on that.
Okay, so antibodies are what happens when our body develops, when our body is exposed to the virus, and then we develop antibodies. And so antibodies are what is our immunity. So antibodies and immunity kind of go together, and that's what helps protect our bodies from fighting off disease. In this case, when we get the vaccine or when we get exposed to COVID-19, our body's immune system takes over and develops antibodies that helps us fight off the disease if we come into contact with it again. Unfortunately, with COVID-19, and this will kind of answer your second question too, we don't know really yet how long that's going to last inside of your body. And so that's, I think, maybe where I was talking about that in the beginning of the presentation, where we're talking about that natural immunity, or even the immunity that's acquired after getting the vaccine. We don't know yet how long it is, but the thought is that it's 90 days is the length of time that it lasts in your body. And so we're still doing more research on that to see what, how long does it really last and how much protection do you have?
Señora, ¿tiene otra pregunta? Ya se lo puse en el chat, lo que la señora, lo que la enfermera contestó.
And Laura, we have a question from Sophia Lara in the chat. Her question is, are people allergic to drugs and medicines eligible for the vaccine?
Yes. So make sure that when you're going in to get your vaccine, that you tell the distributor that you are allergic to certain things. But unless you're really, so the general rule is that unless you're really allergic to something that's inside of the vaccine, that it won't disqualify you from getting the vaccine. But there is a monitoring period. So if you've gone into any of the vaccine clinics or vaccination sites recently, what they do is they administer the vaccine and then they have you sit there for about 15 minutes afterwards. And really this is to monitor and make sure you don't have an allergic reaction to the vaccine after you get it. But yeah, just because you're allergic to certain medications or even certain foods or you've had an anaphylactic reaction in the past, it doesn't necessarily just disqualify you from getting the vaccine, but you'd want to make sure that that when you go into the clinic that day, you make them aware of what you're allergic to and that you've had these reactions before.
Arely, do you have a question?
Sí, ya la mandé.
Oh, okay. Arely's question is, ¿personas con problemas de salud tendrán prioridad para la vacuna? So,
para la vacuna. Sorry.
Vacuna. So if people have health issues, concerns, so I think it's similar, do they get a priority in getting the vaccine?
So right now the state is, they're restructuring their tier system. And so it may be possible that in the near future that people with certain health conditions might be prioritized for getting the vaccine. But right now, that's not how they're doing it. They're prioritizing people who are older. So for the most part, it's 75 and older, or some cases even 65 and older, and our healthcare workers are the kind of first in line, but the legislature and the state are looking at maybe restructuring to include some of those people with those severe health conditions in the future.
Okay, thank you.
There's another question in the chat. Can we register now to be in line for the vaccine? And if so, where?
So the county website, so you can go to rivco.com/coronavirus. And on that site there's a purple banner on the right-hand side that says vaccines. And through there's a portal where you can try and register. The registration process has been difficult, I guess, to say the best. it's been messy, but they're figuring it out. It's getting better. There is a new site that just opened up at Palm Springs Convention Center recently. And so it's improving. And so just keep checking those websites. I do know CVS has recently just opened up some slots too. So you might check those websites as well. CVS and Albertsons, I believe, are doing it. And so it's just kind of luck of the draw at this point. You have to log on at the right time and get an appointment when they become available. So just keep checking those websites regularly.
Okay, and I'll add thank you to Mrs. Perez-Chica. She added the link in the chat, so you can click on it directly that way. Thank you. Any other questions? How about, I have a question. If they do come up with questions later, what can they do? Who's their best resource for future COVID related questions?
Sure. So you can always reach out to me. I'm happy to answer any questions that come up along the way. You can reach me by email. It's ldyson, D-Y-S-O-N, @psusd.us. That's really the best way to reach me. But yeah, if you have questions, please reach out to me. I'd be happy to help get those answered for you.
Awesome. And I'll add that the Family Center can be an additional resource just in case you have other related questions, and that email is also pretty easy to remember. It's familycenter@psusd.us. So you're welcome to reach out to us, and then we can reach out to Laura too for you. So I think this is the time when we give Laura a big, huge thank you. So you can use your round of applause emoji or unmute or clap like this. But we're really grateful that she took time for us tonight to present for us. This is really important. And I appreciate you parents for taking the time to be here. I know you're away right around dinner time. I'm sure you have kids in your house somewhere looking for you. So I appreciate it that you chose to spend the night with us to be informed. We'll be having these speaker series every month. They are already selected for the next few months, but if you ever have a topic that you really want to know about, we want your feedback. Let us know, and we can make sure that we get someone for you to present. Just checking the chat, lots of great feedback. Thank you guys. And then before you go, I'm glad you guys didn't hang up early. We're very lucky because Omar Tinoco, who's the principal for Desert Springs Middle School, he donated 2 raffle baskets with goodies. And so I put everyone's name who's in the chat in a wheel. I'm going to share my screen so you could actually, so you could see the wheel. And 2 people in here are going to win a prize. Here we go. Are you guys ready? Our first winner is Dulce Maria Castro. Congratulations. Okay, and for the second prize, Maria Perez. Congratulations. So we have 2 family centers. One's in Palm Springs and one is in Desert Hot Springs. So if you could please stay right after we get off this, and we'll find out which center is better for you to pick up your gift, either the Palm Springs office or the Desert Hot Springs office. All right. Last minute, any last questions before we say goodnight?
Okay, thank you.
Thank you very much. Yeah, and thanks again to Laura.
Thank you, everybody.
Thank you for everything.
All right. Bye-bye.
Thank
Bye-bye.
you. Bye. All right. Did Dulce and Maria stay in here?